of course, once you have the testing more and more widespread, you need that ability to trace the contacts of everyone who tests positive. And as we've talked about before, when we were tragically seeing the disease spread and spread and spread, we weren't able to do the contact tracing. We were trying to save lives, protect hospitals, deal with the most basic needs of people, but we couldn't build a whole contact tracing network that we wanted for something of this size. Now, the good news is we can. And that's what we're going to build in the month of May. A contact tracing network in this city like's never been seen before on a vast scale. So every time someone tests positive, immediately we can swing into action, figure out who were their close contacts, get those people tested to isolate anyone who needs isolation. So I'm announcing today that we are hiring. We are looking for talented, experienced health workers. So anyone out there listening to me now, watching this, or anyone who hears about this, if you have experience in the healthcare field, if you're ready to lend your talents this fight, we need you, and we need you right away. We are hiring immediately, and we'll be hiring throughout the month of May. City of New York plans to hire 1,000 contact tracers immediately. They will be working with all the healthcare personnel we have already, and people we will train from a variety of city agencies to complement this work as well. But right now, we need 1,000 new contact tracers. We're getting great help from our Fund for Public Health, and I want to thank everyone at the Fund for Public Health for the great work you do, and all the people who support you and have donated to the Fund for Public Health. You're going to see that support come alive in a powerful way now as we fight back this disease here in the epicenter. But we want to get the word out to everyone that we need to hire up right away as this work begins. What will they do? The contact tracers, literally, they'll do the interviews to determine who were those key contacts. They'll follow up with those contacts. They'll arrange for each of them to be tested. Folks who need isolation, they'll make sure they're getting it. They'll help make sure that the steps that are needed are glued together. And they'll ask the questions that are needed, and that training will be so important to understand if there's anyone who needs that follow-up. Talked about disease detectives before. This is a variation on that, but it's the same concept of knowing how to ask the right questions, knowing how to search for the clues of the people in someone's life who tested positive that need to be contacted, need to be followed up on, need to be tested. So again, we'll start immediately. And anyone interested should go to the Fund for Public Health website. It's fphnyc.org. Again, fphnyc.org. Very, very important. Please, we need you to come forward right away so we can get you into this battle and help save lives here in this city.